Good day everyone. I welcome you back to Global Education Zone, and this is the Civic Education course. Feel free to watch this video to the end in order to learn as much as possible. Thank you. In this episode, we are going to be talking about HIV and AIDS, which is a very deadly virus that kills a lot of people each year, thousands and millions of people each year. And HIV and AIDS, HIV actually stands for is the acronym for Human Immunodeficiency Virus, while AIDS means Acquired Immune Deficiency Syndrome. So AIDS is a disease of the human system caused by HIV, and this HIV it infects the body through the blood, and then it weakens the immune system in the blood by weakening those the body cells that are responsible for the body's immune um, resistance, and then it gives a pathway for other diseases to enter into the body of the victim. Now, HIV and it is not a very good disease at all. It's not good in any way because it destroys CD4 cells, which is a special type of white blood cells that plays a large role in helping our body fight disease. So the immune system of the body weakens as more CD4 cells are killed. So one can have HIV infections for years before it develops into AIDS. Now, once a person is diagnosed with HIV infection, it's kind of like almost like a death sentence, except with the continuous use of antiretroviral drugs, which will help to restrict the progress of the disease. There are various causes of HIV and AIDS. One of them is during sexual acts, and the other is during blood transfusion. Then we also have by sharing contaminated sharp objects. Then we also have from mother to child during pregnancy and childbirth or breastfeeding. So these are the four major ways through which HIV can be transmitted. So when the first way is during sexual acts, during unprotected sex with someone already carrying HIV. So that can cause a transfer of HIV, and it accounts for the greatest number of cases of HIV infections around the world. So a person can be infected by any form of sexual acts with an infected person whose blood, semen, or vaginal secretions enter one's body, and also having multiple sex partners spread the diseases quickly. So this is one of the greatest ways by which HIV can be spread. Another way is by blood transfusion. So HIV can spread through blood transfusion. So when in hospitals the infected blood is transferred from a patient to another person, it can cause HIV. We also have the sharing of contaminated objects, which is a very quick way, because these contaminated sharp objects, they can be able to pierce into the skin and penetrate the blood, and so the infections can enter the blood through that way, and it's one of the most of the is an insidious way of transfer. Then we also have mother to child. So occasionally when the mother and child's body fluids come in contact, there could be the mixing of the two, and then you have HIV infection spread, most especially during pregnancy, childbirth, or breastfeeding. But if the mothers receive treatment of HIV infection, then the risk becomes greatly reduced. There are various symptoms of HIV and AIDS infection, because many people with HIV don't know they have the virus, because it is quite an insidious treatment condition, which only becomes obvious when AIDS results. So many of the symptoms of HIV include fever, tuberculosis, memory loss, anemia, aching muscles and joints, chronic coughs. We also have nausea, and so on and so forth. So basically, these are the symptoms. If someone has a combination of one or more of these symptoms, it is a red flag of HIV and AIDS. Then we also have the effects of HIV and AIDS. One of the effects of HIV and AIDS is people die of the disease. It also reduces manpower. It also causes psychological suffering for the victims, because they become pessimistic, because there's a widespread knowledge that HIV is a quite easy easy red flag for mortality. So it is quite known that there's no cure for it. So So when people know this, it's quite easy to become very pessimistic once they know that they have this disease, and they might decide to keep it to themselves to avoid stigmatization. But even that doesn't help. Stigmatization, when people get scared of it, it doesn't help, because it doesn't let people to be aware of the condition of these people, and so they cannot take precautions. And that's how this disease spreads, because most people, they feel stigmatized, and so they don't want to announce the fact that they are actually infected. There's some six potent ways of preventing HIV and AIDS, and the first of these is the abstinence from illicit sex. So there should be abstinence from illicit and premarital sexual intercourse and activities, so as to reduce the chance of HIV spreading, because it is a global problem which everyone should be aware of. The next, there should be faithfulness to partners. Then thirdly, there should be continuous education of people on HIV, its effects and prevention by the government and non-governmental organizations. So when I was in secondary school, there was some non-governmental organizations that used to come to give some talks and seminars on the truth about HIV and the need to be very careful in all one does. So those kind of activities, they are very important to get people enlightened about how serious HIV is as a global concern. The next, injection needles should be used once and disposed of. So people should not use sharp objects, and they should not share it. Also, they should not share sharp objects. Then finally, blood should be tested thoroughly before transfusion. So these are the six potent ways of preventing HIV and AIDS. And hopefully, if these ways are strictly adhered to, then we would definitely see a reduction in the level of HIV and AIDS in the country. Finally, we've come to the end of this video, and you can share your thoughts, your ideas on the topic which was discussed in this video. You can answer these questions in the comment section, or you can send the answers in the number in the description of this video. Thank you for watching, and see you next episode.